Hi, I'm Jesse Mangan, host of the Committable podcast, and I'm here with author and journalist Rob Wipond. Hi, Rob.
Hey, hey.
Do you want to introduce yourself and say a little bit about why we're here and the work you're doing?
Yeah, well, really, I'm hoping this is just a kind of introduction to PsychForce.Report, my new Substack column, an invitation for people to participate. I want to talk a bit about that today. And of course, I'm the author of the book, Your Consent is Not Required: The Rise in Psychiatric Detentions, Forced Treatment, and Abusive Guardianships. So I've been researching and writing about involuntary commitment for a couple of decades. And yeah, so I'm just really wanting to provide a different way for people who don't necessarily have the time or ability or interest to sit down and read a lot, to have a different way of accessing this kind of content. So I'm excited to be able to kind of chat with some of the issues with you.
Yeah, I'm excited for this too, and I'm particularly excited because the extent of experience you're bringing to this is pretty vast. There are very, very, very few journalists who have spent anywhere near as much time focusing on the issue of mental health systems involving force and coercion. So I wanted to ask you, what motivated you to really focus on those issues and get involved with this sort of content?
Yeah, as I write about in the book, the introduction is the story of my father, career college professor of computer engineering, ending up locked up after he sort of reached out for help in a difficult period in his life. And so that was really, really a powerful experience to just bear witness to this. And I actually happened to be living with my father at the time, having just come back home from overseas. So, I really saw firsthand just how aggressive the system could be and how quickly a relatively ordinary person could go from that to certified mental patient being treated against their will. And it wasn't that nothing was happening to him. He really was in significant distress at the time. Nevertheless, right, as we know, that's not an uncommon experience for all sorts of relatively ordinary people to go through very difficult periods of their lives that may last weeks, months, years in some cases, but it doesn't mean they're not still amazing, interesting, engaging, intelligent, thoughtful people who shouldn't necessarily be having all their rights taken away so quickly. And so that's the light that went on for me when I witnessed it with my dad, because for them it seemed routine. And I immediately started to ask, who else is this happening to? And I'd started working in journalism at that time in British Columbia, in the capital city there, Victoria, and a bit in Vancouver as well. And so I thought, well, this is something I want to learn more about. And I started investigating.
As you start this process of investigating, were you aware of how big and complicated this issue would be? You saw your father go through this experience. Were you thinking maybe this is just a fluke? Were you aware of how expansive your work was about to get?
No, I didn't. And it's so interesting now that you've asked that. I haven't thought about this, in years, but the reality is I found it a fascinating intellectual, spiritual sort of issue. So I was just looking at people who, had, as I said, gone through a difficult period and ended up in this circumstance where they're locked up in a psychiatric hospital being treated against their will, and interviewed them about that process and talked to psychiatrists, talked to nurses, talked to other people involved and families and so on. And I was looking at it entirely as a fascination almost with how we define madness, as a society and how we treat it, just purely on that level. And I saw a lot of themes there that interested me as a writer and as a thinker, a person, around what it means to be human, but I had no idea of what I was rapidly to discover, to learn over the next few years about this real scope of the mental health system and these laws in our society.
Something you just said, I think, is really important and not seen enough in media, which is that you said you went out and you talked to people about being committed, about going through these systems. And you also talked to psychiatrists and other people involved in the systems. And I think that focus is so important. As you progressed in your career and your and journalism, really, how did you maintain trying to keep that focus on the people going through it? Because my guess is there are a lot of editors out there who don't really see that as the story. So how did you, as you're going through your career, keep that focus on the people going through the system and not the people administrating the system?
Yeah, it's funny, we look at it, of course, politically now and say, yes, it's important to have the voice of the people who experience it with lived experience. It didn't even occur to me. It just seemed like
Mhm.
so intuitively logical and sensible that those were the first people I talked to. Is like, I want to find people who've had this experience. They're the stories I want to share. Those are the stories I want to tell. And only in part because, yes, I just witnessed it with my father, but just as a journalist, that's the way I always worked with any issue. It's like find the people who are being most affected by it and talk to them. And then, you want to find out from the people who are trying to control it or administer it or, help in the situation or all these things. You get their perspectives as well. But I intuitively always started on any issue with the people who were being most victimized or the people who were most affected by any particular issue, whether it was poverty or aggressive policing in a community or any of these things. If I'm going to write about the school system, of course, yeah, I want to talk to students who whatever, unless I'm focused entirely on what teachers are experiencing. Well, okay then. I'll
Mhm.
interview teachers, but I was not interested in the psychiatrist experience. I became somewhat more interested in the psychiatrist experience as I learned about the complexity of this issue and what's really going on in it. But yeah, so it really came naturally for me to do that. And now I see how important it was and indeed is. And we have all these studies showing that most journalists who cover mental health issues generally, let alone involuntary commitment, um, relatively rarely interview actual people who've been patients in the system, people who've either currently or in the past were patients, and that's just been brutal for knowledgeable coverage of these issues across the board.
Yeah, there's something that's hard to communicate to media generally, which is I've had experiences where people, journalists have come to me and wanted to talk to me about some part of my life, and I've chosen not to have any conversation on the record because I do not trust that journalist. And so it is really to your credit that people trusted you. And as you're building trust and relationships with people who have this sort of unique insight on this issue, the people who've gone through it, what motivates you to write the book? Is it because you just aren't seeing anyone else really diving into this topic? What was the sort of what was the impetus, the moment when you thought there has to be this resource out there?
Yeah. So the journey of what happened there is the first people I interviewed were, of course, people who were out there publicly already. They were becoming activists in this
Mhm.
space, saying, "Hey, I don't think it was right what happened to me, and it didn't help me." And so they were coming with "We're going to educate a journalist." They didn't know me at all, right? But it was just
Mhm.
like, so they came with that attitude. I'm ready, to tell you what
Mhm.
I think regardless of what you're like. And so I benefited from that, right? A few people who came to me with goodwill and good intention that way, like, okay, Rob, let me educate you about all this, and really offered me a lot of books to read and support and the whole journey of their lives and trusted me in that way. And then when that story was out there, immediately that spoke to a lot of people. And so this is a relatively small community, a relatively high profile mainstream magazine, and immediately, and my photos in there, also important because I'm getting recognized in the street in this small community quite often, relatively small,
Mhm.
several hundred thousand. So that really changed the journey quickly. People started reaching out to me, trusting me right off the bat, or at least trusting me to say, yeah, we'll keep this confidential, or whatever they needed. And so I started hearing from people coming out of the woodwork all over the place in the community, like, "Oh, this happened to me, and I'm this kind of person, I'm that kind of person," and I was just amazed at just all the different aspects of the community that seem to be utilizing mental health laws and involuntary commitment as some sort of control purpose, like the school system, like nursing homes, like police forces policing streets, all of these situations where I was suddenly encountering this. I had no idea. Group homes, just everywhere. And so that's when the light really started to go on for me. I started to write about some of those issues, and I just couldn't keep up with everything I was hearing, and realized, like, this is a story of our society. So I had, on the one hand, this fascination with what this means about us as a people, how we understand quote unquote difference and deviance and madness, and also at the same time, what we're doing as a society and why these particular laws have become so important to some sort of thing, which I do call ultimately a form of social control,
Mm.
and that is when you're using mental health laws in the school system, for example, and we're seeing that rate going up a lot, of incarcerating of children in psychiatric hospitals for very short-term holds. They're clearly using it as a disciplinary tool and a control tool that has this mask around it as being the intention to help. But when you're actually incarcerating a child, they're getting handcuffed by police. This is an enormously powerful, traumatizing experience in their lives. And it's so little talked about, even though it's a rapidly rising phenomena. So that's why I call it social control in that sense. We really need to use that language more and more, I think, with this issue. So anyway, to summarize this, I got really interested then in saying this needs to be a book, and I need to have a broader perspective. And at that point, I started writing for Mad in America, the website, blogging community there, and it was growing at that time. So they started having a budget to actually pay for journalism, and I started doing some work where I was looking at what was happening in America as well. I'd been mainly studying Canada at the beginning of this, and now I could look in the American situation as well.
Something I find really fascinating is that this is a subject where you can start out with a journalistic perspective and you can look at it as a matter of maybe a legal matter. Well, how are the mental health laws developed? And as part of that, you have to look at the medical field. How is the medical field approaching these people who are being diagnosed and committed? Then you have to start asking questions about, well, how do school systems operate? Because we've got kids being committed, that now you're looking at international law and crossing borders. And technology, how is technology being utilized by medical and legal communities to enforce these laws? So as you're going through all of these different disciplines and encountering a new discipline with almost every story, how do you adapt to that and stay, I guess, somewhat agile in your incorporation of a new field with almost every new story?
Yeah, I mean, thank you for that summary, because in a way, that's part of what the book became, right?
Mhm.
Too, was this recognition that, it wasn't just all these different types of people or different circumstances in society and institutions utilizing involuntary commitment powers, but the different ways they were being used too. So they were interfacing with surveillance technologies, they're
Mhm.
interfacing with national security issues, right? They're interfacing with all of these sort of range of sort of issues across society, and changes in our culture as well, that as soon as we're introduced, like social media, a great example. So I started talking with more and more people who were just chatting with their friends on Facebook, and then they got a police visit, and they had, how did this happen? Oh, well, now we all know, right, that
Mhm.
Facebook was developing algorithms and allowing people to report on each other through their social media tools very early on, and then they institutionalized it, and now more and more people know that that can happen. But so all
Mhm.
these sort of developments in our society became a part of the book as well. And yeah, and so this is where it, just my sense of the scope of the issue now has continued to expand, even now, right? It's hard to keep up. By the day, we see new ways in which these powers are kind of being employed and utilized and expanded in our society.
So as you spend years covering this, you're broadening your scope. You're going through not just British Columbia, Canada, United States, like all of North America. What are the places where you're seeing the most aggressive or the most complicated or the worst outcomes? What place is the place that concerns you the most right now?
Yeah, well, that's a really interesting question because what I didn't know at the time when I began all of this, I was looking at these very aggressive uses of these laws in British Columbia, and I only really learned in retrospect as I was studying the laws across North America. And these are state laws, for people who don't know that, state and province laws. They're not federal laws that govern involuntary commitment. So, but as I was looking at every jurisdiction around North America, I started to realize that British Columbia is relatively unique in how aggressive its laws really were. So that I was kind of schooled in the fire, as it were, forged in
Mhm.
fire. But what I observe is this, this broader sense of which states are just politically becoming more aggressive, right? Regardless of what their laws on the books say, because that's what I learned is it almost doesn't matter what the laws on the books say.
Mhm.
It's politically what kind of money is driving how many beds do you have, how aggressive are the practitioners in the hospitals, how aggressive are the legislators, what's the public climate like around, what issues are kind of dominant, what rates of certain types of sort of say homelessness is now a common way that people are trying to utilize mental health laws to control homelessness in a certain way. And so those states that have bigger homelessness problems, like, in New York City or California,
Mhm.
we're seeing more aggressive approaches to implementing these laws is, what I'd say. So the implementation is more aggressive. But I mean, I'd be interested to hear you a bit from on this too. Like, what have you kind of seen about, what where do you see the worst versions of the laws as far as you're concerned? And has it affected what's happening on the ground as far as you know?
Uh, it's an interesting question. I think so. When I was committed, it was many years ago. There was a judge who was in the States, and I've never been able to decide whether a judge or a tribunal is better. Like, is it better to have your fate in the hands of one person or three people? I don't know the answer to that. For me, it was very informal. It was just in some random. It was like a rec room in a hospital, and I was wheeled in because I was being confined for treatment in a wheelchair. And that was it, like 15 minutes. The judge was just like, "Yep, go ahead, take them away." But I deliberately didn't look into the laws for many years because I was afraid of being noticed. Going through it, I just assumed it must have been a fluke. I must have hit the wrong judges. This can't be how it actually works. But when I did actually start looking into it, it was sort of a tiered process of expectations being sort of disintegrated. Like my first expectation, I think, was whether United States or Canada, my hope would be there was federal guidelines, federal standards. And in theory, there are almost never really upheld. Just so much wiggle room. And so going state by state, I've just been very fortunate to talk to a lot of really experienced attorneys, and I will read the state law before I talk to the attorney, and then I'll talk to them. And I cannot remember one conversation where the application of the law was what I thought it would be based on what I read. It's all over the place. The systems, they're living things that ad adjust as people interact with them. So I think the worst for me, my response would be the worst system is the one you're in because you have no capacity typically when going through the system to see how it's supposed to be done or how other places are doing it. Even in the place that you are, the system that you're going through, learning how it's supposed to be done isn't always helpful. I've talked to people who have gone through commitments and then cited all of these things that were horrific. The police, they handcuffed me. The police were supposed to do it in the most respectful way possible. They paraded me in front of my neighbors. I was kept in a place where they didn't give me the proper medication. They made me wait for a week in an ER, and I've talked to people who will cite all those things, all of which are understandably horrible and traumatic. But when you dig down on the law, that is the law operating as it is expected to. And so no, it's hard to really say what the worst law is other than it's the one you're in, I
Right.
guess.
Right. Yeah. And I want to, for the audience's sake too, they should know that what you and I are saying here has been affirmed in scientific studies as well. So we have, for example, the one that was done in Europe. They looked at 22 different countries, I think it was, and they concluded that there's no relationship between what the laws say on the books and how many people are being forcibly
Mhm.
treated, how they're being treated when they're being forcibly treated, how many people are being detained, without being forcibly treated, all this stuff. It was just like they could not determine what was affecting. It just seemed, I think a word they used was like local customs.
Mhm.
The habits of the particular institution. And that's one of the main issues that I found consistently throughout all my research, just as you're describing, just as these attorneys are saying, everyone that I've interviewed too that works in these areas, the attorneys, no matter where they are, they affirm this, right? That, yeah, that like the laws routinely get broken. The processes are unpredictable. One person can have a totally okay experience. Another person can be completely traumatized. You can't figure out what was driving one or the other. And that's the problem, right? That's
Mhm.
a major part of the problem. There are no real strong due process protections that would ensure that no matter who you are, or what walk of life, or what situation, that you're treated equally before the law, right? Those efforts that we're making consciously in criminal law largely do not exist here and are, in fact, being deliberately thrown out whenever they emerge. There's a huge resistance to get rid of them again because doctors don't like their power being
Mhm.
encroached upon in this sort of space. And it's really unfortunate.
It's really important to ask more questions. And I understand why people would have passionate opinions relating to this. Some people feel passionately, I want a, a longer say that's more comprehensive. There's no evidence that's going to help, but I understand why you might feel that way. But we should be able to agree that no matter what the duration is, there is due process and monitoring. We should be able to agree. We should all want a more inclusive or a more comprehensive, really analysis of everything that's happening every step of the way. And I think that's kind of what PsychForce.Report feels more like to me because your consent is not required. The book is this amazing compilation of many, many, many years of work. But even after all of that work and all of the lessons you can learn from which you can apply to new situations, all of these new situations just keep happening at a rate that I don't know how to keep up with. And so, with all that happening, that's where it feels like PsychForce.Report is coming in, is that it is a more serialized, more reoccurring, consistent interaction with things as they happen. So, for you, what was the motivation to go beyond the book, to keep writing articles you're writing, but then also to start PsychForce.Report? What was the motivation for you?
Yeah, absolutely. That is what I'm really hoping PsychForce.Report can be, a way of sort of providing more monitoring in this space. And hopefully, not just me, the point is that I'd be crowdsourcing this kind of information with readers and listeners, that they can be helping me. And together, we can have a higher level of awareness of what's taking place around the country in the uses of these laws in all these different kinds of places and in all these kinds of different situations. Because I think that sort of higher level of consciousness around it is really what we need so that we can engage in public dialogue and debate in a more meaningful way, in a way that's more grounded in what's actually happening out there. So thank you very much for your help with this, and I'll look forward to more discussions.
Yeah, I'm looking forward to it.